Welcome to everyone. We'd like to begin by introducing Dr. Omar Latif, CEO and President of Rush University Medical Center.
Good evening. I thank all of you for joining. And I'd like to first welcome you to a critical discussion on really the diverse populations of healthcare professionals, as well as healthcare needs in the city and in the state abroad. I am Omar, and I'm going to get us started. And today, we're going to use as a backdrop a historic Illinois Muslim report to ground our conversation. This 3-year project between the University of Illinois Chicago's Institute of Policy and Civic Engagement and the Institute of Social Policy and Understanding is actually quite historic. It was convened by the Muslim Civic Coalition, a collaboration of over 150 organizations across the state and nation focused on civil justice. You'd have to have not lived the last 3 years to not appreciate that healthcare outcomes actually change based on where you're from, the geography, the zip code, and everything about you. This is a start of a study in trying to better understand that work. Before we get into our presentation, we have this brief video to start with.
Assalamu alaikum. My name is Zahir Sahlul. I'm the president of MedGlobal, which is a medical NGO that provides healthcare in disaster regions. And also I'm on the advisory board of the Illinois Muslim Coalition. And we just passed a historic milestone, which is the completion of the Illinois Muslim Report. And this report was done in collaboration between the Illinois Muslim Coalition, ISPU, and University of Illinois at Chicago Institute of Social Policy and Understanding. The 6 lessons that I've learned from this report, that first of all, our community is quite young. It is diverse. It is educated. It creates jobs, a lot of jobs. 350,000 jobs were created by the Illinois Muslim community. It's civically engaged. And also it's very generous. 83% of our community give more than the average Illinoisan in our state. And this puts a lot of responsibility on us as a community. First of all, we have to read this report and educate our communities and mosques and grassroots organizations and civic organizations and policymakers about this report. We need to build on it. This is a first step. And we need to produce more reports about the opportunities and the jobs and the entrepreneurship and the assets of our community. And we need to make sure that our policymakers are aware of this report and use it to change policies. We have a lot of things to be proud of, and we are humbled to serve the community around us. Thank you. Wassalamu alaikum.
So after that is a sort of, like I said, the backdrop. Today, we'll have a diverse group of healthcare professionals, doctors, administrators, patient support staff. For a brief agenda after this introduction, we have really the pleasure of hearing from Dr. Samir Vora, the newly appointed director of the Illinois Department of Public Health, who will provide some key remarks to get us started, and then hear from an amazing group of people, Dr. Basir Qazi, Dr. Rasha Ali, Fatima Mohammed, Dr. Yusuf Saeed, Dr. Imran Qureshi, Dr. Constance Shabazz, and Dr. Samir Al-Kaduri. Our asks, as you think about the patients that you serve, be even more cognizant of disparities and the impact of disparities. Work towards filling gaps as healthcare professionals. Utilize the skills of the diversity of professionals as leaders and as advisors, and share and support organizations doing this work, providing data, and really building a pipeline for us to improve the care of our community. We begin on this next slide by zooming out. Did you know that the American Muslim story started 400 years ago? Muslims were here from pre-Columbus through the slave trade. They are integrated in an integral part of the greater American story. So ask yourself, when did your story begin? Mine began in Youngstown, Ohio, and I grew into a healthcare field from a passion for both science and community service. And all of us have our own story, and the stories come together and we make a unique part of the population. Put this on your fridge or another important spot. Learn and share your stories. Go to the Muslim Civic Coalition for a downloadable copy. As we zoom in, you'll see that Illinois has the largest per capita Muslim population in the nation, every race, class, and background. This means you are more likely to have a Muslim patient or a Muslim doctor, nurse, or healthcare professional in Illinois than any other state in the nation. A snapshot of Illinois is a snapshot of America's diversity. So the data actually has implications for the entire nation. And before we move on, let's take just a moment to talk about implications around healthcare. I mentioned earlier that you'd have had to live under a rock to know that COVID did not impact different races differently. Understanding a background, understanding a culture, understanding a language is paramount to providing the best care for our population. And understanding the population trends will help us better target high quality care to people that need it. And we'll hear a lot about that later today. I'm really proud to announce the Illinois Department of Public Health's next visionary leader, Dr. Samir Vora. I've had the opportunity of meeting Dr. Vora, and I'll just tell you this. It's fun to introduce a person when you have to sift through 5 or 6 pages of accomplishments to figure out what the 30-second blurb is going to be. In a nutshell, college is hard, so he went to a couple years of that. Medical school is hard, so I figured he'd go to a couple years of that. And then he threw in law school in his free time, along the way picking up degrees and knowledge in epidemiology, community health, social health, as well as social policy. He's accomplished in every sense of the word. His experience in education is phenomenal, and his appointment by the governor represents a historic milestone for a new visionary leader who's going to carry healthcare through the state of Illinois. I'd like to introduce Dr. Vora now to take over.
Well, thanks so much, Dr. Latif. And I want to just say it's always an incredible honor to be on the stage with such incredible healthcare leaders and be introduced by someone like Dr. Latif that I think many of us across Illinois have looked to for his leadership and guidance. I want to thank the Illinois Muslim Civic Coalition for the invitation to this really important conversation. And I think to sort of build on what Dr. Latif sort of said, it's really something special to be able to share your own Muslim story. And I often sort of say that I introduce myself as Indian by ethnicity and Muslim by faith, and how much and how important it was in my personal upbringing to have the importance of the Islamic faith guide me and guide our family in trying to think through how we could incorporate our religion into our very unique Muslim story. I grew up in the city of Chicago, then moved to the suburbs, and now I currently reside in Springfield. And in each of those locations have found a really passionate, a really diverse, and a really moving set of individuals that have worked to sort of guide their faith into the greater American story. It has been such an honor since I've been in this position, now nearly 2 months, to have gotten such incredible support and such incredible words of congratulations as I have tried to think through the many ways that we can sort of build a healthier system here in Illinois post the COVID-19 pandemic. And to this point, I think that Dr. Latif articulated, much of that means understanding the intricacies of various populations across the state of Illinois, what their individual culture and upbringing, and how it sort of relates to their ultimate health outcomes. In this, I think, incredible report that came through from the Illinois Muslim Civic Coalition, the Institute for Social Policy and Understanding, and the UIC Institute for Policy and Civic Engagement, is it really dove deep into where some of the immediate challenges for our Muslim brothers and sisters are. Two sort of really important pieces that when I reviewed the report really sort of rung true is that one of the needs was access to appropriate health care. And that 1/4 of Illinois Muslim respondents said that they needed immediate care in the past year, and they reported that they don't always or sometimes or never get that immediate care. Secondly, one of the other needs was affordable, culturally appropriate mental health services, and that Muslims within the sample were less likely than the general public to seek out therapy services. Only 13% of Muslims compared to 24% of the general population, despite suffering from mental illness symptoms at the same rate as the general Illinois population. And what that tells me is that there are still many, many barriers for our Muslim individuals, and we just saw from that slide from Dr. Latif, more Muslims in Illinois than any other state, that they're not giving, and we're not sort of extending the appropriate universal healthcare opportunities to extend their hands and say that, well, we need to find the right culturally appropriate, be culturally humble in our healthcare system to understand the needs of our Muslim populations, but also even more broadly, understand how diverse and different our Muslim populations are. And I think that is true not just for Muslim populations, but populations of every ethnicity and faith all across Illinois. Much of that is sort of getting the right access to getting the right training, but also then thinking through what it means to build the right system. We need to have individuals readily available to sort of provide that access. We need to sort of create the understanding of what that access means. And then we also need to sort of figure out how to deliver those culturally appropriate systems. And to that, it's not just the healthcare system, but the total community system in which people think through health and healthcare delivery services. And often to that, I think through the social and structural determinants of health. That in order to build the right kind of system where people are the healthiest, we need to think through the root causes of what makes somebody healthy or unhealthy. And often that's issues like poverty, and that's issues like education. And really building the greater health system means really understanding all of those social issues as well. And so as I wrap up these brief remarks, I want to say that as the new leader of the Illinois Department of Public Health, it is my sort of mission to better understand each and every community. As a Muslim myself, the Muslim community holds such a deep place in my heart and want to figure out the right ways to learn from all of you, but also engage in building the right systems to move us forward. So I want to thank Dr. Saeed and Dr. Latif again for this invitation, and look forward to kind of listening throughout the call and learning from all of you.
Thank you, Dr. Latif and Dr. Vora, for getting us started. Two phases of the discussion are next. First, our experts will speak to the demographics and how healthcare professionals and communities are making great impact. Second part of the discussion will focus on needs that the healthcare professionals must better understand and fill. At each slide, the speakers will share their own professional expertise, data, and anecdotal experiences. And remember, you can access the full report now at www.illinoismuslims.org.
And please, as you're looking through the program, please note what Dr. Samira Vora has helped us all understand and has set the tone for how do we better serve all our patients, and as patients, how do we better advocate for ourselves and our communities. Dr. Shabazz?
Yes, and I'm so honored to be a part of this. My name is Constance Shabazz. I'm a physician. I have a master's in public health, a master's in business administration, and a master's in public administration. And I did all that because I wanted to have a better understanding of our system and to be able to bring that to the communities I serve. I'm the CEO and founder of the Salaam Community Wellness Center. And this was started right at the beginning of the COVID-19 pandemic in response to what we saw as the inequities in many communities, including those that where many Muslims resided. So it's a pleasure to be talking about this topic and talking about the diversity of Muslims in Illinois. As you can see on the slide that we have a number of different ethnicities, people from all over the world who comprise the Muslim community in Illinois. And I just want to say that historically, Illinois and Chicago in particular has been seen as the Mecca for Muslims in this country. So it is no surprise to me that we have the largest population of Muslims in the US. And just to say, even though 25 counties were queried and surveyed to get this data, that we know that there are many others who perhaps did not feel comfortable because of the way that the systems that we have in actually sharing their story. And so we hope that in the future, we'll be able to get into different communities, particularly our Black and Brown communities. And that goes along with the historical nature of healthcare and the fact that so many people have not felt comfortable in disclosing their personal information, particularly African Americans in this country. So we hope that this is going to help to open up more dialogue because we need to get that information. So as you see the breakdown here, where it says whites, sometimes they have combined Arabs in there, and also Blacks on that schematic also shows inclusive of both African Americans as well as Africans, so immigrant Africans. So we want to be sure that we are clear about that. So the next slide, please. So, as we know that most Muslims speak English, but there are other languages that are often spoken among our community. And one thing I would like to share with you, I was doing some work with one of the Muslim communities on the South Side where I reside. And one of the things that they talked about was the concern they had about many of their members of their masjid who were not getting adequate health care. And what they indicated was because about 40% of the membership of that masjid spoke different languages, primarily from Western parts of Africa, when they sought out health care, oftentimes because of the lack of communication tools between them and the healthcare providers, and a lack of cultural understanding, that they were not getting adequate care. And so this is a key area that I hope that out of this report that we will be able to address more effectively, making sure that everyone, despite their background, their language, that they will be able to get the proper amount of care. And last one, please. And here we see that, as mentioned earlier, that Muslims, we have a younger population, and that's great. But that also brings with it some of its challenges. Sometimes we look at it as, well, that means that we're going to have longevity. That means that people are how would you say, raising their families in the community. But also it brings the challenges because we want to be sure that our young people are having the kind of support within the schools. And so we want to make sure that there are policies that address the uniqueness of our families, our Muslim families. So this is a very important thing to take in consideration as we look forward in terms of both healthcare, but also building healthy communities.
Thank you, Dr. Shabazz. This is Basir Kazi. I would like to thank the coalition for inviting me to help moderate the presentation today. I'd like to thank all our Zoom viewers. This is an extraordinary panel to be on, and I'm humbled to be here. I am a gastroenterologist by trade. I am part of the largest single specialty gastroenterology practice in the nation, the GI Alliance. Of my various volunteer roles, I do serve on the Chicago Muslim Medical Alliance Board, which is a non-for-profit organization focused on education and looking after those who are underserved. So I'm blessed to present. We learned a lot from this report. Personally, if you haven't read the report, I really encourage you to do so. I have the honor of presenting some of these slides, and one of the slides is the one you're seeing right now, that Illinois Muslim respondents are more likely than the general public to hold a college degree or higher, 40% compared to 28% of the Illinois general public. For me, and as Dr. Latif was speaking, my own story, my father left India at the age of 18 for a higher education. He came here to go to college. So this is something that's well known in our within our community, that education within the Illinois Muslim community is held very hard. So 40 to 28%. So if we can go to the next slide, please. So the next slide is as an asset side, diverse expertise. So 1/5 of the Illinois Muslim sample works in the healthcare field. And there are many experts in the field. I am also a medical educator. I've been in medical education my entire career. And just looking at, from a medical education standpoint, looking in healthcare, we can see the diversity that's come within our community. I work at Luthern Hospital, and just looking at the demographics, anecdotally, from where we were 19 years ago to where we are now in regards to having Muslims representing the medical staff, representing the nursing staff, the ancillary staff, is simply amazing. We learned with data now that 21% of Illinois Muslims are in healthcare, and education is right behind that. And healthcare and the Muslim population, I think, really came forward during the COVID pandemic. I'm part of as I said, the CMA, and we were involved in providing nutrition, hot food for medical staff and nursing home staff. We were involved in providing PPE. So during the pandemic, we learned that that Illinois Muslims do represent a significant portion of the healthcare, but that was anecdotal until now we have a data point to refer to. If we can go to the next slide. So majority of Muslim respondents donate to community organization, what we call zakat and sadaqah, charity and philanthropy. And we compare that, it's 83% to 46% of the Illinois general public. This is of no surprise. I'm going ahead here, but the next slide talks about faith. And when you take faith, and I'll kind of put those slides together for you, as I heard it, 84% of Muslims stated that their faith was very important to self-perception, compared with 39% of the Illinois general respondents. So when you take faith and spirituality, and you take the slide before, which is talking about giving, and you take those in healthcare, which is about healing, they all go together, because the Islam, this is all into this. So we have our faith, the spirituality, but within the spirituality, the act of giving. So giving our time to our patients, to the healthcare needs of our community, to try to serve the underserved. So, for example, I'll take the example of the organization I'm involved with, from giving during the pandemic, but even after the pandemic, providing free healthcare. So we're trying to establish free health clinics, and we're trying to link that with faith-based organizations. So we established a free clinic at a local mosque in the south side of Chicago. Now, this is open to healthcare for all. it's not inclusive of Muslims. So these are some small steps that we're taking as an organization and trying to bring not only healthcare, but education by providing scholarships in underserved area, in the Harvey area, as well as the Rockford area, to improve the education of our local community. That's it for my slides. The next slide is.
My name is Dr. Imran Qureshi. I'm a board member for IMANA, the Islamic Medical Association for North America. I'm a physician here in the western suburbs of Chicago. I've been living here for about 18 years or so. Again, honored to be a part of this panel of esteemed leaders. I bask in the humility of all of you guys. Great accomplishments. I have a sort of a meta slide here. And I don't mean to be the one detractor, but this was from the Lilly Family School of Philanthropy, IUPUI. And it's sort of a meta slide about Muslim charitable giving. As Dr. Kazi was talking about, we have zakat and sadaqah. As I'm sure most people are aware, zakat is the 2.5% required. Sadaqah is whatever is given beyond that. This study showed that people's interpretation of zakat, whatever one believes, is open to different opinions. Some people think giving in kind, maybe a smile, helping someone cross the street, those sort of things are part of zakat. And depending on your means, you can do a lot of different things. Despite all those different definitions, what this study showed was that the Muslim charitable giving was actually quite significant. As you can see on the slide, 1.8 billion was donated in 2021. When you take that across households, that's over 2,000 per household. And when you factor in all the different economic classes of people, immigrants that have just come over that are struggling to people that have been established, that's a pretty substantial number. As we know, during the COVID era, people were getting bonuses and stimuluses, people were losing jobs, having a tough time getting through. And these are the numbers during COVID, and they actually went up from before the COVID. So that was quite impressive. As you can see, a lot of people, probably second generation or first generation from immigrants, donate to a lot of international nonprofits, the governments of those countries. But interestingly, over 20% of people are also donating domestically. And we'll talk a little bit later, there's a lot of Muslim organizations that do domestic charitable work. As on my role as IMANA, which is a nonprofit, we found that, as a lot of the people here are represented for nonprofits, you work by donations. I know that for myself, I've been a board member on there for about 12 years. It was always difficult to ask for money. I would just show people what we did. And then we hired a fund development director, and she said, you know what, just ask for the money. So I bet you probably half of you have got, anyone in my contact book has probably got a message from me once a year said, hey, this is what we do. Would you like to give money? And the response that we get is amazing. And that just sort of corresponds to some of the slides we've seen. People are like, oh, yes, either they'll say, what do you do? Or tell me more about what you do, or yes, I've already given. So the TLDR is that Muslims do give quite a bit, and even in these difficult times. Next slide.
Thank you, Dr. Shabazz, Dr. Kazi, and Dr. Qureshi for sharing your expertise along with the data. We are now at the second part of the discussion, where we will focus on needs that healthcare professionals must better understand and serve. At each slide, again, the speakers will share their own professional expertise, data, and anecdotal experiences. Remember, you can always access the full report at www.illinoismuslims.org.
Good evening. My name is Rasha Ali. Thank you so much to this esteemed group for having me here. Dilara, thank you for putting together an amazing roundup. Dr. Vora, thank you for your introduction, and Dr. Latif for being one of our MCs as well. I am a comprehensive ophthalmologist by training, also a cornea specialist. I'm in private practice in the northwest suburbs of Chicago. I stand here today as a liaison for American Muslim health professionals, and I've also had the privilege of working alongside Dr. Qureshi, along with IMANA. In my spare time, I also contribute to working with Hayat Clinic, which is a non-for-profit clinic on Devon, which serves predominantly a South Asian immigrant population. So I have been asked to speak today on the Illinois Muslim economic profile. As Dr. Shabazz alluded to previously, the theme of the Muslim community is that we are so diverse. And this disparity is seen as well in our economic profile. So if you recall from Dr. Zahar Salu's earlier talk, Illinois Muslims actually produce 350,000 jobs a year for the state of Illinois, and we only comprise 3% of the population. However, though, the converse point is Illinois Muslims also still have a higher rate of unemployment than the average public. You can see here from this slide that there's a 20% rate of unemployment among the Illinois Muslims as compared to 13% of the the general public. So this just speaks to the fact that there's an income disparity and that we are not a homogeneous demographic. If we could go on to the next slide, please. So I found this slide to be particularly interesting. So ISBU came up with a slide which alludes to, the reported degree of disability that people perceive themselves to have. So Illinois Muslims disproportionately represent themselves as having a lower rate of disability, 8% versus 21% of the general public. This is almost 3 times less likely to be perceiving yourself as having a handicap. So one thing that came to my mind is, why does this exist? Is it because there is a lack of comprehension? As Dr. Constance Shabazz earlier spoke to, she mentioned that there is a diversity and a plurality in the types of languages we speak. So is there a comprehension barrier to understanding this? And then for me, the second question that came to mind when I saw this slide is, how does that translate in terms of access to healthcare? We have this minority population who is underreporting their disability and then not seeking professional help for it either. So if we could please move to the next slide. Okay, so as Dr. Qazi previously told us, 20% of Illinois Muslims identify themselves as healthcare workers. And Dr. Latif also mentioned the fact that you're more likely to find a Muslim healthcare provider in the state of Illinois than you are likely to find them anywhere else. So despite this, though, if we could go back to the slide, please. Thank you. Despite this, and despite the fact that we're a more generally well-educated demographic, Illinois Muslims report themselves as scarily 25% chance of not being able to access healthcare in an expedient manner. Dr. Vora mentioned this as well. And so basically what we're seeing is that the Illinois Muslim population is twice as likely to have difficulty with access to healthcare as compared to the general population, of whom only 13% endorse themselves as having difficulty to care. So if Illinois Muslims are a microcosm of the country, what does this mean for the rest of the country? So this is an interesting subject, I think. So this begs the question, number one, why does this disparity even exist in the first place? 2, what are the barriers to care? How do we identify them? And then 3, most importantly, how do we rectify them? So I think further studies to answer these questions are clearly needed. I think that's it for my part. Thank you.
We could go to the next slide. This is Dr. Imran Qureshi again. So one of the things that came out of the Illinois Muslim report, respondents were asked, what things are you most concerned about? As you can see this graph, 2 of the most concerning things were Islamophobia and the economy. But you can look at number 3 there is healthcare. If we took this survey maybe 10 years ago, 15 years ago. Maybe some of the other things would come up as more important as foreign policy and the economy. Maybe Islamophobia is something that's become more important in this more polarizing times that we live in. But interestingly, healthcare is just there, almost one of the largest concerns for Illinois Muslims. And as Russia just mentioned, about their access to care. Next slide, please. Just a quote from an imam in Chicago, and I won't go through this whole quote, but the gist of this is the imam is concerned about security because of Islamophobia, putting armed guards at doors of masjids. And your question would be, how does this sort of tie into what we're talking about? Well, there's a huge mental health component. You can just think of a child that needs to come into a building or look on the news about violence that's happening and worry about, is this going to affect me? It's going to affect the adults as well. It affects the leadership in the community. It becomes a focus of conversation. So this can contribute to sort of the mental health stress, which is something in our community we often don't focus on. Next slide, please. So I'm a radiologist by trade, and sometimes when we look at an image and we need to describe a bunch of nodules or cysts, and there's too many, we just say TNTC, too numerous to count. So we wanted to put a list of some of the healthcare organizations, like what can one do to sort of combat some of the issues that we were just raising. So we distilled this down to some of the organizations from Chicago or with Chicago links, and there's probably many more, so I apologize for any organization that's not on there. But you see the Syrian American Medical Society started doing work, or really did quite a bit of work with the Syrian conflict, and now they've done belief work that expands beyond Syria. We saw Dr. Sewell, the founder of MedGlobal, talk about the disaster work that he does in his organization. IMANA, the organization that I'm in, 55-year-old organization, that was just a group of doctors getting together in like 1967, involved into one of the largest relief organizations, also based in America and from Chicago. Everyone's probably heard of IMANA, the Inner City Muslim Action Network. And as they've grown and gotten their grants, they've developed a very robust healthcare clinic. Salaam Community Wellness has done the exact same thing in the south side of the city. Hamdard Center started off with mental health concerns and expanded to full primary care coverage. The American Muslim healthcare professionals have become leaders in the space of public health and policy and advocacy. And then, of course, Compassionate Care Network, run on the north side of Chicago, was one of the first free health clinics and developed a sort of a novel way to fund this and create sort of like a little pseudo insurance for people that don't have access to care. So you can see there's a lot of places to give. And a lot of time people ask me, I have some money, where should I give my zakat? Where should I give some sadaqah? Obviously, I'm a member of IMANA, so I mentioned IMANA, but my answer there is give it anywhere, as long as you've vetted the organization. If you take the net amount of healthcare that is needed versus the amount of incoming resources, that's a huge deficit. So there's room for these organizations and many more. And a lot of these organizations work in synergy, they work together to do the best job that they can. Next slide. And I put up the slide just as an example of what we do with IMANA over the last 15 years or so. We've treated over 3 million patients. But before we were giving this, planning this talk, our organizer said, you know what, talk about a personal story. So I won't focus on the slide as much, but having been on a few different relief missions, I was challenged by my organization and people in it early on, hey, why don't you come on to a medical trip with us? I'm an interventional radiologist. I have a very tight focus of what I can do, and I'm a little nervous. How am I going to treat a pneumonia? How am I going to treat like someone with an infection or something? But it went along, and it was an incredible experience. I've been to a couple of missions, and I know many of you have as well. The personal example that really hit home for me, we were in Gaza. There was a 5-year-old boy. He had obstruction beyond the bladder, and his kidneys were failing. So we had to put a catheter in the kidney, and we had to sort of improvise how we were going to do that. We didn't have all the right tools, and we were able to do that, get the catheters in. And it's very rewarding when we take care of patients, here in our practices, but there was no feeling like I had at that moment. The patient's family members were crying. They were just in total, I don't want to say awe, but in being extremely gracious for what we did. And sometimes when I give talks about our relief work, I say, we're here, we have fancy equipment. I have like $1 million machines to do procedures. And we're like, yeah, good job. Here, we didn't have much. So the entire process really is incredibly rewarding and kind of reaffirms why I'm in the healthcare space. So My parting message, this is my last slide, is for those that are interested, contribute to these organizations, sign up, get your hands dirty, and go on one of these missions. So that's all that I have. Thank you. Next slide.
Yeah, hello. Thank you, Imran. My name is Yusuf Saeed. Can you see me there? I am a physician by training. I am a pain physician. I trained as an anesthesiologist, but I practice chronic pain management. I currently am the chairman of pain medicine at the DuPage Medical Group. Actually, it's now known as Duly Health and Care. It's the largest non-hospital-based group of physicians, over 1,000. I also hold a degree in business administration from Kellogg Graduate School of Management. I want to thank the organizers of this for including me on among these pillars in healthcare: Dr. Latif, Dr. Vora, Dr. Qureshi, Dr. Rashali, Dr. Shabazz, and if I've missed anyone else, I thank you all. But I wanted to talk a little bit. Can we go to the slide? I wanted to talk a little bit about the issue of mental health and what this important landmark study has brought up. I know Dr. Vora spoke a little bit about mental health in his opening remarks, and certainly this data here showed, and he quoted a lot of the data from the study, and I think it's all very telling. And I think number one is that as a chronic pain physician, I think this is a very important thing to me that we look at even in more detail. And a lot of that is because of stigma that's associated with mental health. And as a pain physician, I deal with a lot of patients with social stigmas. Usually it's stigma associated with chronic pain or stigma associated with opioid usage. But we know that people with stigmas are people who basically are looked at as outside of the social norms. And there's a certain amount of the stigma that's associated that creates a prejudice against them. And so when we look at mental health in the general public, we know that it's underreported. We know that people have mental health issues. But this study particularly, it was when it asked a very simple question: what barriers are there to seeking mental health care? and only 20% of respondents said that they had no reluctance in seeking mental health. And all the other answers include 80% of those that had some type of reason for not wanting to seek care if they had mental illness. Those issues, according to the study, include cost, embarrassment, lack of Muslim resources, lack of trust in the system. But in the end, people are not seeking care for mental health. And certainly we need to find out and look into this issue more. Is it because of just the general stigma in the general population of mental health and the stigma associated with it? Or is it something unique to the Muslim population? And I'd just like to address just one concern I have, which is that the Islamophobia is a form of stigma as well. And it'd be interesting to see the correlation between the stigma that's associated with all of us that we have with being Muslims and in an environment which is fairly Islamophobic, and how that relates to our own mental health and certainly all of the mental health of our patients, and if that in any way correlates, because we know that mental health certainly can lead to certain types of disorders that are even physiologic. Can we go to the next slide? This is kind of an interesting slide. It just says that Muslims don't drink that much, but I mean, certainly it's 5% report that they do, and this may even be underreported. And I think that certainly when we talk about stigma, we should also look at that among those who drink alcohol. Let's go to the final last slide, and this is an interesting one to me only because we talked about the Muslim story, and my story is that my father came when he was in his teens, like Dr. Qureshi's did, and I was born and raised here. And so the question is elderly care. I mean, and so we see a lot of, from this study, it shows us that elders are cared for by their adult children in their homes. They transport them, they take care of them, they're their social network. And the question I think that really is this a function of our community? Is this a social value from Islamic or a culture point of view, or is it something that is going to be changing? And so I think that it's important to look at this further. Whether are we going to need assisted living facilities for our elderly, or are we going to be caring for them in our own homes, like those of the first generation did? And I think in many ways these are going to be very important questions to ask as we move forward toward our elder care. Thank you very much. Next presenter.
Assalamu alaikum and peace be to everyone. Thank you, Dr. Yusuf, for everything. My name is Fatima Mohammed, and I'm a patient care supporter, and which is one of the most important in Muslim help, Muslim women help during the time of the Prophet. I'm also an Islamic educator at the Nigerian Islamic Association, and also with the Illinois Muslim Civic Coalition, being part of the community organizer. Today, we're going to talk about needs for more halal options. The slide, please. Illinois Muslims sample more likely to lack the access to food that meets religious dietary guidelines. And 94% said halal way of life is important to them. And specifically, 94% of Muslims stated that it is somewhat or very important that their purchase decision be halal. Reports provided a broad understanding of halal, and also it is a way of life. Serving food that is religiously acceptable to individual patients is an essential part of patient care. Most hospitals serve vegetarian food, hummus, and Muslim patients which they consider halal. Halal should include meat and varieties of food in the menu to choose from, and not just vegetarian food and wrapped hummus. Some Muslims automatically believe that meat provided in the hospital is halal as long as there is no pork, which is not possible. Healthcare professionals should ask patients upon admission of what religion they are, and make sure patients get the right nutritional diet. And Muslim Civic Coalition is sponsoring a bill in 2022 for halal, kosher food, and vegetarian food in hospitals, prisons, and schools. We hope to include and serve all communities, regardless of race, faith, or background. Next slide, please. I'm going to talk about the domestic violence reporting is lower than general population. Domestic violence is one of the serious health problems women from different race, culture, social classes, and societies go through. Trauma from immigration, generational poverty, discrimination, and other factors create a home scenario where those who feel disempowered will hurt others. They go through emotional abuse, threats, violence during pregnancy, controlling husbands, and verbal threats, which always lower their self-esteem with the threats. Women don't report the issue until it gets worse, to the point of depression, anxiety, high blood pressure, mental disorder, physical and sexual problems. Men who are victims of abuse are even less likely to speak out. When domestic violence victims come to the hospital, they are still in fear to speak. They don't speak up the abuse they are facing. Through assessment, the patient, when asking them questions, that is when they say something, but the healthcare professional have to assure them that there is support and for them not to live in fear at all. Children get affected very badly when they are in the situation with their mother. They run away from home. Some go to college and never come back home. Victims also don't report being in abusive relationship because they are afraid of being stigmatized in the community. Undocumented status, lack of support, don't know who to talk to about the abuse, and lack of education. Even though we have come a long way towards improving education and access to success for women and girls, gender violence is still a large problem. Professionals should educate women, men, and young children in different communities, organizations, and politicians about domestic violence, and don't wait until something happens because some women will not speak out. They are afraid. During the pandemic, women have to deal with husbands' unacceptable behavior and face emotional abuse, harassment, because the spouse has nowhere to go during the pandemic. Next slide, please. Also, I'm going to talk about bullying. Nearly 1/3 of the Illinois Muslim sample with school-aged children reported having a child who faced bullying. It's very challenging. Bullying is a serious risk factor that contributes to physical and mental health problems such as anxiety, depression, and trauma. It results in children feeling lonely, hopeless, and rejected among their mates. They start thinking of committing suicide by cutting themselves with sharp objects, overdose of drugs, choking, and hanging themselves. And sometimes, even if they have access to guns, they use it to shoot themselves just to end their life and end the pain. Aside from peers, adults are also a source of bullying or talking down to children and demeaning them. We can prevent some of these by educating the healthcare workers about bullying. It is not only a school issue. And then the pandemic might have helped decrease bullying because of homeschooling during the time of the pandemic, but bullying started again when kids returned to school because some have gained weight and they are being ridiculed by their schoolmates. This is what I have for today. Thank you.
Good evening, everyone. My name is Samar Al-Qadari. I'm a head and neck surgeon at Rush University Medical Center in Chicago, and also a board member for the Syrian American Medical Society. Thank you to the Civic Coalition for putting together this wonderful panel, and thank you to our colleagues on this esteemed group of healthcare professionals that I'm lucky to be standing next to. We have some asks. It's very exciting that now we have such a integral part of the community in Illinois, and we have some data that now we have a story to share, and it gives us somewhere to start. We have some asks of you now that we've just created this report, which has had many presentations, a lot of interest from a variety of people in all aspects of government and in the area about how starting as a groundwork to help cater to these communities. But number one, we need to be aware that there's disparities all around us. There's inequities. And often, once we can identify these and understand, then us being a critical role of the healthcare system here in Illinois, then we can play an integral role to improve upon these disparities. So we have to be aware of it, whether it's for Muslim patients or for patients of all races, all religions, in all communities. And then once we've identified and understand this, then we can act. And you can act whether it's the way you treat that single patient, it can impact the way they view their healthcare providers in the future. Or whether it's understanding that some of the patients that we're taking care of have a very different socioeconomic status and situation. And so just being cognizant of that is the right direction to try to remedy some of these. I'll just say as a personal story, I have 3 young girls all under the age of 6, and I'm thinking about their future and the community that they're going to need to be a part of. And I think of the community that when we first started, and so it's essential for us to put this information out there, to continue to develop it over the years, ask better questions of our Muslims in Illinois, and identify their needs and help to bring all forms of inequity. It's one of the tenets of our faith. And so we're lucky to be able to practice that in our day-to-day. Next slide. And as Dr. Qureshi had mentioned, we have many organizations that impact what's happening in our close community, as close as you want to get, and when you zoom out. So my personal example is I'm involved with the Syrian American Medical Society, and one of my first years out as an attending, I was given the opportunity to perform surgeries on the borders of Syria. This opened up my eyes and to what we can do and what the needs are and how we can try to impact this. But the more interesting thing was the physicians that I was seeing that were doing this and that were inspiring me were those physicians in our community here in Illinois, and those are the ones that started organizations such as SAMS and MedGlobal and IMANA and IMANA. So this story will continue to develop into a story that we will all be proud of. I thank every one of you for taking the time to listening to us. I thank you to the Civic Coalition for engaging us and setting this up. Thank you to all the leaders that are on this panel for everything that you do and that you continue to do. And I look forward to our future meetings. If you have any questions, please ask them on the chat. If you have any, please look forward to our future roundtables set up by the Muslim Civic Coalition. Thank you all very much for your time.
Thank you all for joining us